what foods are consumed for improving egg quality and sperm quality. Now, before coming to the foods which are to be consumed, let us first see what is healthy BMI. Healthy BMI or body mass index is around 25 for both males and females. BMI from 25 to 30 is known as overweight. Above 30 BMI is called obesity. Above 40 BMI is considered morbid obesity. So having a near normal BMI, which is around 25, is ideal to prevent any diseases, improve your health, and even fertility. So it is important to have a BMI near normal, which is around 25. If your BMI is more than 25, then consult a dietitian for diet. Also start some exercise at least 4 to 5 times a week for around 40 minutes to reduce your weight and get your BMI near normal. 7,000 to 10,000 steps per day also will help in reducing the weight. Avoid junk food, avoid canned preserved food and high calorie food like deep fried food with cheese, butter, ghee, or sweets which are having high content of sugars or even processed sugars. So all these foods are to be avoided. Now coming to the foods which improve the fertility. So what we advise the couples is whoever is trying for fertility, you should have good amount of protein in your diet. Proteins can be from animal origin or plant origin. Animal origin proteins like eggs, chicken, fish can be consumed. There are other options like even red meat, but red meat is considered to have high fat content and also has bad effect on your liver leading to fatty liver. So these are the animal origin foods which have high protein content. Now coming to the plant origin proteins. Plant origin proteins are found in various pulses and legumes. All these, especially the sprouted ones, will give you good amount of protein along with fibers and vitamins. Other than these proteins, you can also consume protein supplements with the advice from your doctor. So these are about various foods which have proteins. Then there are other animal origin products like curd, paneer, which are formed from milk, which you can consume for your protein intake. Now, second important nutrient for egg and sperm quality is folic acid, especially for the women for the egg quality. Folic acid is part of vitamin B complex. So folic acid is present in sprouted legumes or even eggs and animal origin proteins. Coming to the third nutrient, which is multivitamins and antioxidants. So antioxidants are required to reduce the oxidative stress to the cells of the body. Egg and sperm are very critical or important cells. Any oxidative stress which can happen because of high level of cholesterol, blood pressure, sugar, or even our daily stress, smoking, pollution, all these oxidative stress is reduced by the help of antioxidants and multivitamins. These oxidative radicals, what they cause is they actually cause damage to the DNA of the egg and sperm. Hence, if you include multivitamins and antioxidants, the DNA damage to the egg and sperm is reduced, improving the quality of egg and sperm. Multivitamins and antioxidants are found in colorful fruits and vegetables. Any seasonal fruits and vegetables in the raw form should be eaten. There is no need to go for exotic fruits, but the regional and also seasonal fruits and vegetables will be more helpful for the body. Having those fruits and vegetables in the raw form will also give you fibers which will help in digestion and maintaining your healthy weight. Now coming to the fourth nutrient, which is omega-3 fatty acid. Omega-3 fatty acids are present in various seeds and dry fruits and also in the seafood like fish. The omega-3 fatty acids are required for the cell structure and hormonal metabolism. So these omega-3 fatty acids which are present in different seeds can also be consumed in the pattern of seed cycling. You must have heard about seed cycling for fertility. So what we do in seed cycling is the menstrual cycle is divided into two. First part is follicular phase where the egg development happens and the luteal phase where the pregnancy happens. So first part of the menstrual cycle, which is follicular phase, usually flax seeds and pumpkin seeds are taken to support the development of the egg and estrogen balance. Second part of the cycle is supported by sesame seeds and sunflower seeds. These seeds will will help in maintaining the progesterone balance and help in conceiving. So even seed cycling is very common nowadays. But whatever diet you're going to follow, please take advice of the dietitian or your doctor. If you're allergic to any of these foods, you should avoid these foods. So coming to the fifth important nutrient for fertility. So fifth important nutrient for fertility is minerals or micronutrients. Minerals can be multiple like iron, selenium, zinc, magnesium. All these minerals have different functions in our body like secretion of hormones, maintaining the quality of the egg and sperm. Now coming to the first mineral, which is iron. Iron is very important for females because they lose some amount of blood in every menstrual cycles, and most of the women in India usually do not have sufficient iron in their diet. So it leads to the iron deficiency anemia. If your blood hemoglobin is already on the lower side before you conceive, then your body iron stores will be depleted and your baby will also have affected growth and low iron stores. It can also affect the pregnancy, like it can increase your risk of bleeding in the pregnancy, increase the risk to the baby of infections. So it is important that you maintain your hemoglobin between 10 to 12 at least before you plan your pregnancy. So iron is the most important mineral which is required for females. Iron is found in multiple dietary sources like dates, jaggery, animal origin products like eggs, liver, chicken liver, mutton liver, also in plant origin sources like green leafy vegetables and even in legumes. So these are different sources of iron. Now coming to the other micronutrients or minerals, which are zinc, selenium and magnesium. These are present in small amounts in many things like seafood, also in seeds and dry fruits. So it is important to take seeds and dry fruits in diet but in limited quantity because most of the dry fruits has high content of the fat compared to the proteins and these micronutrients. So consult a dietitian for proper advice. So this was about the diet which will help in improving the fertility and improving the egg and sperm quality. Now coming to the supplements. So which supplements we give in fertility to improve the egg and sperm quality? Women, what we give is folic acid, vitamin C, vitamin E and coenzyme Q10. So folic acid, vitamin C, vitamin E are the vitamins. Coenzyme Q10 is an antioxidant. All of these will help in the egg quality. What we give to both partners is vitamin D. Other than being a vitamin, it also has a role in your endocrine functioning. So vitamin D is given to both men and women. Now coming to the supplements which we give to men. So men usually receive supplements which are having antioxidants like coenzyme Q10, lycopene, multivitamins and minerals like zinc, selenium and vitamin C. So these are the different supplements which are given to men. But taking any medicines over the counter or without advice of a doctor can be harmful. So it's always better to go by your doctor's advice. I hope this was helpful.